Houghton, who you probably know very well. And we are really, really excited to host this kind of new format of question and answer sessions specific to one topic with an expert. And so, if you have not gotten a chance to learn about Dr. Roughton, see her in any of the Bustmob ways that she helps the women of Bustmob, we are definitely want to hear an introduction and learn a bit more about her. But you probably know that this live is about weight loss and specifically the surgery and plastic surgery that may come after weight loss. And weight loss could be a bunch of different things. We've even learned in this community and in this industry that it's hard. What is weight loss? We've all lost and gained weight here or there. And some people have had gastric bypass surgery. Now we have these amazing GLP-1s and people are losing weight, but a lot of us have had multiple pregnancies and lost weight. It does something to our bodies. And so whether you consider yourself a weight loss patient or a mom who's gained and lost weight, we're just basically going to talk about the different questions you guys ask and the different topics about what weight loss does to our bodies and how we could potentially address those with a plastic surgeon. And there's honestly probably no one better to talk about it than Dr. Roughton because she does them all the time. It's honestly something we do a lot of. So thank you, ma'am, for being here.
Thanks for having me.
What do you consider what do you consider a weight loss patient?
Well, I used to not really consider it at all. I thought everybody was
Yeah.
the same. And I will tell you that I've learned through experience that there is probably a difference, and it's probably 80 to 100 pounds, or obviously more than
Hmm.
that. That I feel
Hmm.
like in some ways, just the brief way to say it in my mind is like the elastic is a little bit shot in your pantyhose. Like things just don't quite rebound like it would if perhaps you hadn't had that much change. But some
Hmm.
people gain 100 pounds with pregnancy too. Like
Hmm.
it's not, every individual is a little bit different. But what I have found, so the kind of the first thing that I noticed was that if you've lost that much weight, man, you don't just have laxity up and down in the abdomen, but you have laxity side to side. So I started doing
Hmm.
more fleur-de-lis tummy tucks, where you have the vertical incision and the horizontal incision,
Hmm.
because that can really get rid of more skin. If you only pull it in one direction, you don't. But
Hmm.
then I started noticing that my implants weren't behaving quite the same. And I think it's because I had this huge influx of patients that had lost a bunch of weight. And people don't always look like they lost a bunch of weight. You can't
Hmm.
always tell that you used to weigh 220 and now you weigh 120. But I noticed that my patients that were having more displacement, a little bit more sag with their implant, like, hmm, tell me more about why that's happening. And then I discovered that, well, not discovered, but became a little bit more confident that that patient is just a little bit different than somebody that hasn't had that much change.
Hmm. So is that something you dig into at the consultation more, or somebody even lets you know? Because I bet most people don't identify as that always.
Exactly. And excuse me, it used to be that I would read it on their surgical history: Roux-en-Y gastric bypass, duodenal switch, gastric sleeve, lap band. But if you lost a bunch of weight either through diet and exercise without a GLP-1, or you were on the GLP-1 and you're not taking it anymore, it's not listed on your medical history. So
Hmm.
now, and don't be mad at me if you're 18 and you weigh 99 pounds. I'm still going to ask you, what was your max weight? And you're like, 99 pounds. And I'm like, well, I just need to know. And
Hmm.
so it's part of my history taking now, because I'll treat you a little bit differently if you've had a whole bunch of weight loss.
Hmm. I'm excited to dig into that piece. And I know this topic might seem strange to some people who are in bus mob because bus mob seems like just a breast implant community. But really, if you've been around for the last few years, hopefully everyone has noticed it's really that was a fun name, but it's a topic around a lot more than just breast implants. So we will definitely cover pieces of that. But I'm excited to honestly ask you about different things too, like arm lifts and thigh lifts, and it's whether you've had a weight loss too, these are surgical procedures that are at least an option for tightening up skin. Because
That's right.
unfortunately, I'm waiting for that wand to be invented that tightens skin without surgery. But unfortunately, in my lifetime so far, that has not happened.
I tell people that too. I just don't have a reliable non-surgical way to tighten your skin. Some people will
Yeah.
respond a little bit, but typically, like large amounts of loose skin, the only cure I have for it is let me take it away with surgery.
Yeah. Well, okay, let's talk about so gastric. I'm more familiar with the more because gastric, when I was patient care coordinating and seeing patients more often, that is who we saw bariatric patients who had insurance cover this surgical procedure. They lost an extreme amount of weight very quickly and then realized, oh my God, I'm out now. If I want to get the skin removed, and I would often hear, I actually like my body even less now,
Oh,
because of this skin.
yeah.
And now I have to pay 30 or 40 grand to
Mm.
have it removed when insurance paid for my gastric. GLP-1s are newer to me. And I think the emotional and the speed at which they lose weight is different. So do you treat regardless of how they lost the weight and diet and exercise? Someone who just went, I'm going to do it, diet and exercise. Are there any differences in their health, in their when you'll do surgery on them, their outcomes, anything like that?
So they're so new that I can't refer you to the chapter in the textbook on how you manage it. So I'm just going to tell you how
Mm-hmm.
I manage it. And you may find, and plastic surgeons are so annoying because we all do stuff a little differently and we're all convinced that we're right. So that's unfortunately part of the charm. Um, so the gastric bypass patients or duodenal switch, the surgical patients, we were trained that we needed to wait 6 months from their kind of getting to their new baseline weight before we
Mm-hmm.
started intervening. And so you can just accept that blanketly, which I, as you may, if you know me, I'm annoying. I refuse to do that ever. But that probably has to do with them being in a catabolic state, like they're breaking stuff down because their body thinks they're starving, even though they're not, right? And then those people, most of them, not so much the gastric sleeves, but the duodenal switch and the gastric bypass, they're malabsorbing as well. So you may eat 3,000 calories or however many grams of protein, but you don't then absorb all of that. And so you're wasting some nutrients, and sometimes they have trouble healing. I don't see that as much with the GLP-1s. They're not really malabsorbing, they're simply eating less, and their transit time, at least at first, is a lot slower. And so they
Mm-hmm.
feel full, they feel more full, and they simply eat less. So I don't think they have the same, in general, nutritional deficiencies that we would see with surgical weight loss.
Mm-hmm.
Do I do a different surgery for you? No.
Mm-hmm.
There are a couple little things on the back end. Like I do, it just makes sense to me. Like, let's get you to your baseline weight before we start intervening, right? Because I've
Mm-hmm.
seen it. I mean, everybody's seen a
Mm-hmm.
patient that we thought 150 was her baseline, and she comes back a year later and she's 120, and I'm like, what happened?
Mm-hmm.
And life happened or changed, and I
Mm-hmm.
think more than about 20 to 30 pounds, you start to get more loose skin. So I'd like you to be within that goal, no matter how you lost your
Mm-hmm.
weight.
Mm-hmm.
And then if you're on a GLP-1, there are some potential risk with anesthesia if you don't hold the GLP-1. So that's something else. We want you to be, at least our anesthesia team says, at least 7 days without the medicine. And I know that certain places they may tell you 14 or 21. I mean, there's all kinds of
Mm-hmm.
different, again, it's newish, but the most
Mm-hmm.
recent data looks like 7 is good enough. You have to be
Mm-hmm.
no GLP-1 for 7 days before the surgery.
Mm-hmm. Is there any sort of supplementation that you recommend or don't recommend for it? Because I know a lot of people, I don't know, we get that question a ton, even in Bustmob, about protein. Like everybody wants to be part of their own healing journey and be as healthy. We're too aware right now, but yeah, uh, regardless of if I've had a weight loss journey or not, do you recommend supplements or anything like that?
At the moment, I don't. I want to correct any nutritional deficiency that you may have. So, again, things like micronutrients like zinc, for example, is really important in wound healing. But the only time I learned about that was in residency, taking care of patients in the burn unit, because those patients in general are so metabolically stressed, they can't take in enough nutrients to heal. And so would actually check for some of those micronutrient deficiencies. This is a different setting, right? Like we're not a big burn victim. Like we're healthy in general, women who want to look better. Like that's a, whoa, what happened here? So I haven't thought about that stuff in a long time until I got to the patients that had had surgical weight loss that were having some trouble healing and was like, I wonder if it's that. And then you check that stuff and it's low, and then you learn to check it ahead of time and things like that. But in general, those surgical patients are still followed by their bariatric surgeon, who most of them are seeing those patients for a bit of time. And so I like to refer them back there. Let's make sure, is somebody checking your labs? Can I have a copy of them? Those types of things. The patients ask me all the time, should I take a protein supplement? I'm like, well, I mean, you're pretty healthy as it goes. What I say is don't start smoking. Don't become a couch potato. Like keep up your activity level, keep up the things that you know to be healthy eating.
Mm-hmm.
Don't get, people ask me, do I have to stop alcohol before surgery? And I'm like, yeah, after
Mm-hmm.
midnight, the night before. But what I don't, don't go on a binge, things like that, like just smart behavior. It may be
Mm-hmm.
that going forward, we'll have more information that I can give you that says you'll do even better. But what we run into is people are so dang healthy that to be super healthy is hard to measure that. Who joined us?
Mm-hmm. I know we have
We
guests.
have
We
a
have a
friend.
surprise guest. Apparently, it is kind of fun. Well, so I know I've told this story to you. I'm sure other people have. They've had to hear it. I got into plastic surgery 22 years ago because my sister lost 100 pounds. This was, I'm aging myself, early 2000s, and did the Atkins thing, and that just it blew my mind. She was 22 years old, lost it through diet and exercise and nutrition, and then went, I can't live like this. Like I have grandma boobs, and got this done, and it was just her vibe afterwards was so different that I was like, where can I typed like I actually went to a computer, which no, I didn't. I should open the newspaper that I found this
Put
job.
little
Like,
ads, that's
and
hilarious.
I found a plastic surgery job here 22 years ago doing that. But I know she also wasn't happy with her stomach. She's still, and now that's been 22 years. She's still contemplating a thigh lift at some point. But like, how do you help people know which surgeries to have at which times, and are there recommended ones? Because a lot of people, I mean, the arms, there's a whole, there's a litany of things that weight loss can do to you.
100%. And everybody's a little different. And I go back and I'm like, hey, look, guys, we all have a shape. We were born into that shape. Some people are shaped like
Hmm.
apples, pears. You hear about all of these things, right? But
Hmm.
like you have a fat pad, you developed it. Everybody has one. It got big, it got small, but it's still there. And so really it's tailored to the individual. What bothers you? Some people, they don't care about their arms. They wear shirts. They're like, I don't care. Nobody sees that
Hmm.
except me. Or they don't care about their breasts because they're wearing a bra and they can hide that. Um, it's all of a balance of what bothers you and what procedures can we combine safely, and then
Hmm.
trying to get that. Let's say you're somebody and you're not limited by time out of work, you're not limited by how much you can afford. You just want everything done from head to toe. Well, everything can be done head to toe, but we have to think about how to do that as safely as we can, meaning what can be combined. So, for example, I won't combine tummy and thigh lift together. I feel like there's
Hmm.
just a little bit of lymph nodes in the groin between those two areas, and I need there to be enough healing. So
Hmm.
I won't do. And the other thing is, we know that 6 hours is kind of the max amount of time we want somebody under general anesthesia for them to be
Hmm.
safely discharged home, for them not to
Hmm.
have fluid shifts that need to be monitored in the hospital. And so it's what we can get done in that time. Um,
Hmm.
in my practice, I have the best team in the world. I think they could go against anybody. And like I tell my patients, they kind of chase me around the table. So if we're gonna do, I'll do arms, breast, and tummy. That's probably the most I'll do on any one person, and
Hmm.
or I'll do arms and thighs together. So I
Hmm.
might start on your arm. Then I'd get all the deep stuff in. They chase me around. They do the last layer while I'm doing the second arm. And then they chase me around. I go back over here and do the right breast while they put the last layer in the left arm. So we're moving as efficiently as I know how to do to get all that done in a short amount of time.
Hmm.
I get that patients want as minimal recovery as possible. And so one of the other things I'll tell them is that um, all the recovery is with the tummy. Anything you do with the tummy tuck is pretty much a free recovery because the
Hmm.
tummy tuck is the thing that's like, oh, it just
Yeah.
feels tight and uncomfortable. And that, whatever else we can plop in at that time is great because you won't notice it. And I speak
Yeah.
from experience. I had my tummy and my breast done together, and they looked different. They had tape on them. Didn't feel them. Couldn't tell.
Yep. Yep. I have heard that over and over and over. How long after, if somebody does want to do it in stages, let's say, and make a plan for it, how long do they need to wait between procedures?
So I tell people it's about 6 months, but I'll also tell you up front, I'll give you a date if you want to hold that date on your calendar. But that
Hmm.
said, I bet you're not ready for a year. Like your mind is
Yeah.
ready, but then
Hmm.
once you've recovered, it's always a little bit more taxing than we think it is. Maybe not even
Hmm.
physically taxing, but mentally taxing. You went through
Yes.
this whole procedure, you had to get better, you didn't feel as good, your energy level was down. Oh my God, I was in a garment. Oh, it was uncomfortable. Oh, I'm out of it. Oh, I feel so good. Oh, my swelling went away. And it's hard to jump back into, I got to do that again. Okay. So most people in my practice tend to want to be 9 to 12 months in between, even if they in the beginning were like, I need it done as soon as possible. They tend to space it out, in my experience, a little further.
Yeah. I feel like financially I would need to do that regardless. And we could talk about pricing at some point too, if somebody wants to. Um, how about liposuction? Like, because I was thinking, so when I did my tummy tuck, I added on inner thigh liposuction. So glad because again, it was a free recovery. Didn't even pay one bit of attention to that liposuction. It was so great. Do patients still require or need, is it still benefit to add liposuction to a post weight loss patient?
It depends. It depends on where your fat pads are now, right?
Hmm.
And so if it's just loose skin, oh, and let me speak to that briefly. You guys, to a person that I've met, there may still be an exception. If you've lost 100 pounds, you probably have some body dysmorphic disorder, meaning you look in the
Mm-hmm.
mirror and see somebody heavier than what I see or other people see when they look at you. And so you're going to pull at this skin because I know, because I do this for a living, and you're like, ah, this is so fat. And I'm like, no, it's loose skin. So
Yeah.
liposuction will not tighten your skin. And you've got to
Mm-hmm.
convince yourself that is not, you're not pinching something this thick. You're pinching something that thick. There is no
Mm-hmm.
fat there. So assuming that what you have is loose skin, and I will tell you, believe me, I do this for a living. I cut into it. I see it's just skin. Um, you don't need much liposuction. So in general, that's not the part of the surgery that will make your life better. It's the getting
Mm-hmm.
rid of the skin, pulling the muscles back together. Those things will make your life better.
Mm-hmm. I we do so many breast lifts, breast reductions, tummy tucks, thigh lifts, arm lifts, back lifts, even.
Hmm.
But I don't, we don't do as many, or like I feel like some it's newer, like the lower body lift, or we get into talking about BBL some. Like, what do you do about the back lower part?
Well, you can kind of play with it yourself. Meaning that sounds weird when I said it that
That
way.
sounds weird.
That did. I'm sorry. Back, rewind. You can pinch your back skin and see, like, and so I have so many women that come in and they're like, "Oh, I hate this," and I'm like,
Yeah.
"It's your skin." You may not want that trade-off. You've got to kind of play with it. So if you want to treat the upper back, you really can only treat that with a bra line back lift. So that's a scar that goes
Hmm.
across your back, right where your bra strap would be in the back, and kind of
Hmm.
lands underneath the breast. Um, you hide it in your bra, but obviously that's if you're naked, you're going to see it.
Hmm.
That is the only way I know to take care of loose skin in the back. Now, the other thing that happens when you've lost a ton of weight is that your butt kind of falls down. And so if you pull the bra line back lift doesn't raise up the buttock, unfortunately. So that's a
Hmm.
separate incision that's at the top of the buttock. So if you can imagine at the end of the tummy tuck scar, you can go all the way around.
Hmm.
Now, as an outpatient, meaning you're not going to spend the night in the hospital, I won't do that together. I won't do the front and the back together. You've got to have a
Got
way
it.
to recover. It typically needs described anyway with drains. I'll do it as a
Hmm.
second stage.
Hmm.
So you could do completion abdominoplasty, which is what that's called when you connect it in the back and raise the butt up. You could do that with your thigh lift or your arm lift or perhaps a face procedure, but I won't do it at the same time to go all the way around.
Hmm.
And I won't do
Yeah.
your BBL and your abdominoplasty together anymore either. I learned the lesson. Those patients were frustrated with me because
Yeah, I can only imagine.
I know.
I remember the whole circumferential body lift thing, and
Mhm.
I'm just like, you look cut in half. You look like you were cut in half. That must be a tough recovery. I realized I did skip over. I mean, again, tummy tucks are probably the most common thing that we do.
Mhm. Yep.
And there are multiple types
Mhm.
depending on your needs, how much skin, excess skin
Yeah.
you have. Like,
Understand.
tell me again, because you mentioned fleur de lis. I understand what that means, but can you walk me through the different types of tummy tucks?
Um, and the other thing that's confusing is that you get like colloquial terms
Yeah.
thrown in, and then it's like, I don't even know what I'm talking about. Sometimes I'm like, what am I talking about? So traditional standard tummy tuck is an incision from hip to hip and an incision around your belly button. Okay.
Okay.
There is something called a mini tummy tuck, which I'm still a little bit mad at you, Greta, about when you had that,
Sorry.
because it's much harder for the surgeon in case anybody cares about poor
Yeah.
surgeons. You don't have an incision around your belly button. You just have an incision from hip to hip, or sometimes a little less than that. It depends on how
Mm-hmm.
much skin you take off as to how long the incision needs to be. But patients with laxity above the belly button are not a good candidate for mini tummy tuck
Mm-hmm.
because the belly button stays fixed, so you can't
Mm-hmm.
move that skin down. And what you don't want to do, and trust me, it looks terrible. I've seen it thankfully from others, but if you just tighten below and you don't tighten above, it doesn't look right. So
Mm-hmm.
I will say there's not that many women that are great candidates for mini tummy tuck,
Mm-hmm.
but I will do them if you are, I promise.
Mm-hmm.
And then there's extended tummy tuck. What does that mean? Well, it's like
Mm-hmm.
the traditional, so scar around your belly button, scar from hip to hip, except it's got to go further back. Why does it have to go further back? Well, sometimes you have a pannus, like you have a hanging skin flap, which frustrates people to no end, and they want that gone. And if I stopped at the hip, you'd still have this like big extra piece. So we have to go a little
Mm-hmm.
further back. The other reason why you might have to go further back, even if you don't have a super hanging flap of skin, is if I've got to take off this much skin, it has to close nicely, and it just makes it, the more you take off north and south, the further east and west you have to take it off in order to get it to not pooch out on the sides. And I think about an ellipse. Like if you, the longer the ellipse is up and down, the taller it is, the longer it has to be in order to get it
Mm-hmm.
to lay right.
Mm-hmm.
And then finally, there's the fleur de lis tummy tuck, which is when you have a ton of excess left and right and north and south. And so that has an incision up and down around the belly button and hip to hip. And then you heard me say the word completion, which
Mm-hmm.
is when I connect it. Some people call that a belt lipectomy. Some people call it a 360 tummy tuck, which gets confusing because then we talk about tummy tucks with 360 liposuction. So what is happening? And so it really, that means we liposuctioned your back at the same time. But if you're hearing 360 liposuction, that doesn't mean we went all the way around with the scar.
Mm-hmm. How do I'm so curious how you talk to people psychologically in a consultation about the scarring. Like I understand how beneficial fleur de lis are having this incision, but I can imagine that's a really tough thing for people to
Yeah.
get over. They've already lost all this weight. Now they have this extra skin and they're like, I'm going to have, I mean, that's
True.
tough.
It's true. The I had a patient. I'm going to steal. I told her I was going to steal it, so she knows. She did not trademark this comment. But they all struggle with it because even though they may have been on groups and they may think they're a candidate, like said no one ever, like who wants a scar you can't cover up in your bathing suit, two
Yeah.
piece? No one wants that. But it's kind of like who wants a mastopexy scar? I did. You
Mm-hmm.
know, those scars will fade. But this patient told me, she said, well, I thought about it a lot. I'm going to go with the fleur de lis because you told me you could get off more skin. And
Mm-hmm.
she said, I might, if I'm lucky and I develop more self confidence, which I hope I will, wear a two-piece bathing suit twice a year. But I hope to wear a fitted dress twice a week. And she said that she would rather feel more confident in the fitted dress and not have loose skin than she would worry about having a scar that wasn't covered up in a two-piece bathing suit.
Mm-hmm.
And I thought, well, that's a really good way of putting it. But you're right. I can't control how people heal, and it's not easily covered up in your underwear. It's
Mm-hmm.
not.
Yeah.
And that can be frustrating for people.
Do any different precautions? My sister swore that her scars were different than my scars because she was a post weight loss patient. She's like,
Awesome.
my texture of my skin is different. I have stretch marks. Do you have to do anything different, or do you recommend any different scar protocols for people who have lost more
Don't.
weight?
That's a pretty common thing. I was going to mention it. I was thinking about it when you were asking about
Mm-hmm.
fleur-de-lis because I'm only going to do a fleur-de-lis if you have laxity in those directions. Those are massive weight
Mm-hmm.
loss patients, kind of by definition. And it is true, although I can't prove it, but it's true. Their skin is
Mm-hmm.
thinner. They just don't mount in general. I do have one exception that's coming to mind, of course, because I try to never use words like never and always because then I'm immediately like, but, but anyhow, in general, they just don't seem to mount as much of a thick scar type of thing. Maybe because the dermis is thinner, because it's been stretched out before. Same people that have
Mm-hmm.
stretch marks. Patients with a bunch of stretch marks, let's just say you're not massive weight loss. You're just a patient who has a ton of stretch marks from your pregnancy. Those scars tend to be finer than people that don't. And so
Mm-hmm.
there is something about the way the patient heals. And I wish I could figure it out and then make everybody heal like that. But so
Mm-hmm.
far, I don't have anything different. And we ask people to do the same type of thing, which is
Mm-hmm.
I think it's essentially temperature and pressure. And however you achieve that on your scar, whether you do it with paper tape, which we do for 6 weeks, whether you're doing it with your scar cream, your scar salve, you're massaging it in with friction, you're wearing silicone strips, like it's probably related to that. And the
Mm-hmm.
more people do to their scars, I honestly think they do look better faster. What I'm not sure about is do they end up getting to the same place long term? Because time is a huge factor with scars as well.
Mm-hmm.
Nobody's
Mm-hmm.
scar looks great at 3 months compared to 3 years later. I mean, but we
Mm-hmm.
kind of lose interest. Like, how often do you see
Right.
somebody show you a picture of a scar 3 or 4 years later? Which is my justification for disrobing to most of my consults. Because if you're afraid of the scar, I'll just show you my scars, like because I'm 4 years out now.
Yep. Yep. I swear my surgery was January. I think this was 6 years or maybe five. I don't know. But I try to remember it at least once a year post a pic. But at first I was taking pictures every day. But after a year, I could barely even see it. My pictures aren't even exciting anymore. Like
You're like,
it just you can't see it at all. I was gonna ask you a question about muscle repair, but that right away made me realize I didn't really ask you about a paniculectomy.
oh,
I mean, huge topic here because then that gets
yeah,
into insurance. And
that's
don't get me started, and I'm sure you feel the same. I get it. It should be. I don't know. These people,
well,
if a breast reduction is covered, I don't know. So what's a paniculectomy?
paniculectomy just means you cut off the hanging piece of skin.
Hmm.
And you don't do liposuction, you don't pull the muscles together, you don't transpose the belly button, you just cut off the hanging piece of skin. And in general, the plastic surgeons that are doing that don't even require the patient to have lost weight. Like you, when I was working in the hospital, I mean, it wasn't me, but there were people doing paniculectomies on people that weighed 4, 5, 600 pounds because that panic has its own problems. It has
Hmm.
lymphedema in
Hmm.
the panic, it can drag. I mean, you don't want to know.
Yeah.
And so it's frustrating, and then they want to help them, but they don't heal well. You
Hmm.
can still qualify for a paniculectomy if you've lost a bunch of weight, but it tends to not be an aesthetic. It's not designed as an aesthetic operation. It's designed as a
Hmm.
functional operation to get rid of the hanging
Hmm.
piece of skin.
Hmm.
Um, I'm lucky now that I can kind of avoid the whole insurance battle
Hmm.
because of just kind of our office policy. As you know, like we just don't deal with insurance companies. But
Hmm.
um, it was interesting because when I was faculty at the hospital at UNC, we had looked back. So you can't do a surgery in an academic medical center unless you get pre-authorization, unless it's an emergency, right? But
Hmm.
elective stuff, plastic surgery stuff, you get pre-authorization. So despite getting pre-authorization, which the patient had to jump through so many hoops to get that, we had not been paid. The hospital had not been paid a dime on a paniculectomy for like 18 months. Like as far back as we went, zero reimbursement. So it's a crazy system that we live in. I was just going to
Hmm.
complain. I complained already to a patient today, but I'm going to complain here live. I picked up
Yeah.
3 prescriptions from the pharmacy yesterday, and two of them they were like, "We went ahead and did it as cash pay because it's cheaper than with your insurance company." So like, I don't make the rules. I don't understand, but it's frustrating for everybody involved in that.
Yeah, I hate that when people have worked so hard and they truly have this physical thing that, breast reduction. What makes me mad is gynecomastia. Literally was at Wrightsville Beach this weekend looking at men walk by who needed gynecomastia surgery, but then realizing it was annoying because insurance can pay for that.
They will.
but will fight women who have double G breasts and are disfigured, and I'm like, man, you and your little man boobs, that's not disfigured. Anyway, we could go off on a tangent on insurance. It's very infuriating to me. But muscle repair,
Yeah,
that's what led me to the peniculectomy.
sure.
Because I have also had a lot of people go, I just want the skin, or I don't need, I haven't had kids.
That's
I've
right.
just had a large weight loss. I don't really need muscle repair. Can you speak to
Um,
that fallacy?
I will speak to it.
Yeah.
So this is elective surgery. I will not
Hmm.
force you to do a procedure you don't want to do. I won't do it
Hmm.
while you're asleep because you can't stop me. Like so, but what I will do is talk to you about it. So if you've weighed a lot, it doesn't matter if it's a uterus that's pushing out or it's just fat that's pushing out,
Hmm.
something pushed out. The six pack muscles, the rectus abdominis, are designed to spread apart, especially between the belly button and the pubic bone, probably to allow for women to have pregnancies. Yes, because you don't
Hmm.
want everything all tucked in because you can barely breathe and eat towards the end of pregnancy anyway. You don't want
Hmm.
that to be worse. So you're designed, that's the weakest part of the abdominal wall. Um, I used to like lay people down and make them do a half a sit up and put my fingers in between. And then I realized that wasn't, what was that doing? Nothing,
Hmm.
because they're all going to
Hmm.
have it. I'm literally going to, for lack of a better term, lift up the hood on your
Hmm.
abdomen. I'm going to raise
Hmm.
up the skin off the muscles. I'm going to see them. They're always a little bit apart in massive weight loss, with or without children, even on men. Now, I did stop doing muscle repairs on men. They didn't notice it, but I realized I was creating an hourglass that I didn't think really needed to be there. So I did give that
Oh
up.
my God, I have never thought of that.
Oh,
We
yeah.
got a bunch of curvy men out there. That's amazing.
We have a few. Um, but I will do it for women. And so the next thing I noticed, so after I noticed they were all a little bit apart, um, and I can't do anything funny with it. They don't overlap. Like I'm just gonna, they
Hmm.
either are apart or together.
Hmm.
Um, I had a few patients just ask me not to do it because they were like, well, I just want the easiest recovery or whatever. And I felt like they had the same recovery.
Hmm.
So I thought, well, my goodness, if it doesn't
Hmm.
have any risk per se, I mean, I'm sure everything has some risk, but if it has very little, no known accepted risk, it has the same recovery. Well, let's just pull them back together and that'll help you with your
Hmm.
shape and it'll help with some function to feel a little bit stronger when you get back to doing your core stuff.
Hmm. That's so neat. I feel, and again, I don't remember, 5 years or 6 years. No, it's been 5 years since my tummy tuck, and my muscle repair. And it's just, I mean, with yours, I mean, touching it it didn't feel like this even before kids. It's solid. So I can't, I'm excited because aging, I feel like everything relaxes anyway. Plastic surgery does not stop the aging process, but muscle repair feels like it's really slowed it down, at least, I would hope. Feels constantly like I'm wearing a garment in a good way. Um, let's talk about arms and thighs really quickly, just for people who are interested. Can you kind of give me an idea of where the incisions and recovery would
Mhm.
be for these kind of ancillary areas?
So I've played with that a little bit too. The
Mm-hmm.
description is between the biceps and the triceps, and I think this is called the
Hmm.
bicipital groove. And a
Mm-hmm.
standard brachioplasty goes kind of from the elbow to the armpit. An
Mm-hmm.
extended brachioplasty is elbow, zigzag in the armpit, and then comes down along the breast. And then that allows us to get some of this
Mm-hmm.
stuff that drives women crazy because they're trying to wear a
Mm-hmm.
bra and the skin is everywhere. It's like spilling
Mm-hmm.
out from a butt. They can't stand it. And so frequently it's an extended brachioplasty for massive weight loss. Now, sometimes it's the forearm too, and you can't have it. It
Oh,
looks
wow.
ridiculous to have a really tight
Mm-hmm.
arm and a loose forearm. So you could take it all the way down the forearm if you need to. That's very uncommon,
Mm-hmm.
but certainly there are people who need their forearm done as well.
Mm-hmm.
And then you asked me where's the incision, and I said, well, it's traditionally
Mm-hmm.
here. Um, I think it's better if we can push it back a little bit to be a little bit more
Mm-hmm.
posterior. Because only if this is the only way you can see somebody's scar, if you're standing like this naked, like that's a weird thing, right? Whereas, like, I feel like you put your arm up in the air, like you will see a little bit more of this scar. So if we get it a little
Mm-hmm.
bit more posterior, I think that that is a nicer place to have it.
Mm-hmm.
And then from a surgeon's perspective, right, I want you guys to be so happy, truly. And I have discovered, and you can laugh if you want, if you can't see it, you're not upset with me about it. So the more I can get you to not see it and other people
Mhm.
not to see it, the happier you'll be. You can't see it that well. Again, if this is the only way to see it, you're fine. And patients tend to be very happy about that. So when you're like this and when you're like that, you can't see the scar. Um, then the thigh scar, very similar. It's along kind of like where the inseam of your pants would be. I'm so tempted to stand up and show you, but I think that might look odd. So along the inseam of your pants. So from the inside of your knee up to your groin, almost always I do those as an extended thigh lift, which means the incision curves up, um, kind of like where your underwear would be.
Mhm.
So inside of the thigh, and then kind of like an upside down L or a hockey stick.
Mhm. What about garments and things like that for after those surgeries?
So we've developed this protocol, and it's going to be a little different for different surgeons, but at least at Amelia and Raleigh, if you have a brachioplasty, we're going to wrap you in something that's called Coban, which is like Ace Wrap but sticky, just to itself. And you're going to wake up just with your arms wrapped. And then whatever other garment you have on your torso, if you did something else, or with your breast, if you did something else. On your shower day, on day 2, you're going to take that all that gauze off, and you're going to notice that there's a piece of paper tape on your incision. And then after your shower, you're going to get into an arm garment. And the arm garments look a little different depending upon what size you are or what other procedures you had done. But in general, they're connected to each other, or it rolls down. So it can connect in the back usually, almost like a, what do you call those things like you'd wear to like a dress up? I forget what
Like a
it's called.
shrug.
Like a shrug, exactly like a
Oh
shrug.
my God, I haven't thought about that in a while.
There, and then it connects in the back and it goes down the other arm. Now the thighs, we'd have you in like a below the knee garment, um,
Uh-huh.
which kind of reminds me of like a Richard Simmons 1985 exercise suit. Um,
We were
which
really dating ourselves, by the way,
I
using
know.
Richard Simmons and a shrug.
Never mind, guys. Don't worry about that. Um, old guy, much older than we are. Anyhow, so you'll be in like a garment that goes below the knee, and then we tend to have you in the stage 1 garments for a week, and then switch into something more like Spanx for weeks 2 through 6 for your compression.
Got it. Got it. This was a good question too. And I wanted to go talk about some facial stuff because I know that comes up with weight loss as well. But
Hmm.
specifically, someone asked a question about combining, a tummy tuck and a lift, and then submental liposuction as well. Like, how
Hmm.
do you know? Because I do know you do submental liposuction. I love
Hmm.
submental liposuction. It's my favorite. But for post weight loss people, I feel like skin would be an issue too. So how do
Yeah.
you know if you're a candidate for just the fat removal?
I, you often need to ask a plastic surgeon is the short answer, because you guys think you are because you're convinced that this is fat. I hate to even pull on it. I'm afraid it won't go
Yeah,
back.
don't pull.
Not fat. No, I'm like, go back, go back. This is not fat. I'm 45. Isn't that horrible? You guys in the med
Stop
school.
pulling it.
No, it may stay that way. Um, if it's thin, when you pull on it, that's not fat. And liposuction, like we said in the beginning, doesn't tighten skin. I'll barely even do submental lipo. If you've crossed 30, you're gonna have to see me in person to convince me to do your submental liposuction, because I don't want to worsen that. Like even on
Hmm.
people that do have something to liposuction, it is going to rebound, but you'll be your own worst critic, and you'll see some areas that just aren't quite as tight as they may have been when you had a bulge
Hmm.
down here. And so
Hmm.
most of them weight loss patients, it really is a skin thing, and you need to go see Dr. Singh to talk about a neck lift, to
Hmm.
get that skin up. I know you don't
Yeah,
want to hear it. I'm sorry,
I
but
know.
I refuse to make you
Um,
be mad at me or be worse by any means.
Dr. Singh is lovely. He's a facial plastic surgeon who works at Amelia Raleigh, where Dr. Roughton works. I don't think I did a good job setting that up in the beginning, that you are one of our surgeons at Amelia Raleigh. Here's me only finally paying attention to the questions. I'm sorry. I
Okay.
was so excited asking you questions. We kind of covered a piece of this, but the question is, how long after surgery do you recommend waiting until restarting my GLP-1 for
Oh,
someone steadily maintaining goal weight 6 or more months?
it's a really good question to which I'm not going to have the perfect answer. I think it depends a little bit on how much constipation you have with the GLP-1s. Some people have more than other people. Remember, it slows down transit, not just through the
Mm-hmm.
stomach, but through the whole intestinal tract.
Mm-hmm.
And so surgery, narcotics, not moving around a lot. Those are three risk factors for constipation right there. And then adding your GLP-1 back can add to that. There's
Mhm.
no, it's not going to hurt you, but you might be smarter to stay off of it for at least a week after the surgery. Now, here's the kicker. If you're on a maintenance dose and you wait more than about 2 weeks to do your dosing, it's possible you're going to get all those symptoms back that you got when you started it. So, a little bit of like low grade nausea, bloating, gassy. So, you're going to kind of have to balance that between how you know your own body and what your prescriber wants you to do. The person who's prescribing the GLP-1 may have more of an opinion on it than I do. What I know is I can't put you to sleep if you didn't hold it for 7 days. So, from my perspective, if you want to start it when you get home from surgery, you can start it then, but you'd probably be smarter to give it another week. So, you waited a week, you give it another week, and then you restart it.
Mhm. I'm sure this is not, you can't give a very clear answer because it depends on what surgery combination somebody had. But now I'm thinking through the emotional piece of not exercising because you made me think about, like, I don't know, that whole piece. And
And
I,
there's
I
this
know.
psychological fear that you're going to gain the weight back. I know that.
Yes.
So,
And people, we already tell them not to step on the scale for sometimes weeks after surgery because my God, I've seen people who just have a breast dog who gain 15 pounds after surgery. I mean, it is shocking sometimes.
remember, that's
So,
not weight, that's water.
yeah,
And you
yeah.
will diurese it off. Like that is not, you are not fat. You did not become fat. You are not, this is not abdominal fat. You are bloated and you are retaining water. And that is normal and it will pass. Go on.
Yep. And I'm sure depending if someone had a bra line back lift or arm lift, this might be different. But like in general, if someone has, let's say, a breast lift and a extended tummy tuck, what is their mobility and then workout and it kind of look like afterwards?
So again, going to be tailored for the patient, and each surgeon
Mhm.
is going to have a bit of a different preference. I am pretty lax about restrictions because I think basically I wouldn't follow them. So therefore, I'm like, well, I think. um,
Just be honest.
I can't be anything else. Um, if I cut your muscles, please let's let the muscle, or I yanked them together with heavy sutures, medically speaking. Let's not use that muscle more than what we have to for 6 weeks. So if you had an under the muscle breast dog, please lay off chest for 6 weeks. If you had a tummy tuck with muscle repair, I need you not to do core exercises for 6 weeks. Now, arm lifts, thigh lifts, breast lifts, I don't cut anybody's muscles in their arms and legs and breast. So for those procedures, I think it's like judgment. So like what I tell people, literally, don't start a kickboxing class. Is not the time. Don't go play tackle football. But if you want to give me like 2 weeks of taking it easy and then slowly ease back into your exercise routine, that's fine. I think cardio is it's hard to hurt yourself with cardio.
Mhm.
So I think it's just see how you do. Give yourself some grace. You just had a big procedure. You're going to be tired, bloated, swollen. But if you want to go walk around the neighborhood quickly, go walk around the neighborhood quickly. See what you can do.
Mhm.
But again, give yourself grace. You're not going to do it as fast as you did it last week because you just had this big procedure. Your body doesn't know that you wanted the procedure done, right? Your body isn't like, sweet, I finally got rid of this skin. Your body feels assaulted, right? You had some
Mhm.
bleeding, you had some swelling, you've been cut, you've been sewn together. Like you got to give yourself a little room to recover. But if I think about 2 weeks off your cardio for me works well. So walking, jogging, biking, stair climbing, those types of things. If you haven't had any muscles cut, to me makes
Mhm.
sense for you to do that.
And I'm sure, yeah,
It's for
I know it's
this.
individual.
It's for this. This is why you
Yeah,
have to do it so that you'll
yeah,
feel better about yourself and
yeah.
how the endorphins and all of that that you need to feel good.
I know it's hard. I just think this is so much harder for women too. And I actually did want to ask you about moms versus not moms, but being we're both moms, and so I get a lot of the questions of when should I have this? Should I do it during the summer when my kids are off, or should I do it when they're back in school so I have more time? But then I'm usually get the what about if I'm going to Disney in 6 weeks, or my kids have we're going to Aruba, and those are tough ones. We just nobody has
There's
downtime.
never a good time. It's like when you're gonna have the next baby.
Yeah.
Oh man, it's tough. If you're a teacher, well, those they generally will have surgery in the summer. right? That makes sense. They have the 3 months off or whatever, however many months it is. It may not be three. Um, Otherwise, I think a lot of my patients don't want to have surgery in the summer because, just
Mhm.
like you said, they're trying to travel, they're trying to be in a bathing suit. You know, this isn't the time that they want to be. It's also hot and humid in North Carolina. And
Mhm.
so
Mhm.
you don't typically want to be in a tight compression garment when it's 94 and 100% humidity outside.
Mhm.
Again, it's a balance. What I tell people, if you have a wedding, a trip that's, an international trip, like something that you just literally cannot miss, that's not the time to plan surgery. Let's do it
Mhm.
after we get back. Because God forbid you have a complication, you have something that's not healing well, and I tell you you can't get in the water or you can't lift your luggage or whatever that is. I don't want to ruin
Mhm.
your trip. And so, but then that still doesn't work because they realize, well, I know, but I got this thing and I got this other thing.
Mhm.
So 6 weeks. Don't plan your surgery six. If you can do it after you get back, that's best. Second best case is a minimum of 6 weeks before you have to be doing something really important in your life. I just
Mhm.
I don't want to be the person that you're mad at when it doesn't work. If God
Yeah.
forbid you did have a complication. So by six
Yeah.
weeks, you should be out of your garment. Tape should be off, and you should have your energy level pretty much back to normal. You
Mhm.
still will
Okay.
be a little swollen compared to
Oh,
what you would be 6 months later for sure.
yeah. Yeah. At 6 weeks, I thought I was looking amazing, and then around 3 to 4 months, weirdly, I like lost all like a. It was felt like it was overnight, and I've heard that multiple times. But it's funny. I thought it looked great at 6 weeks, and
Yeah.
then looking back, I'm like, thank God, because it got way better. But yeah, it's still. I went shopping at Target. I had to get out of the house. I had the good anesthesia blues or whatever, that 6 day mark where I just cried for like an hour for some reason, which I always think about it like drugs or anesthesia is leaving my system. And then I'm like, I got to get out of this house. And I went to Target and tried on clothes with my garment on. But it was already like I was a size smaller 6 days later, which is just amazing. Even though I knew I was swollen, it didn't look good. It was bruised and lumpy, but it was already a size smaller. It was that kept me going through all of the yucky stuff. And I hear that a lot, especially with abdominal surgeries and even arms. Like the girls in our office who have recently had arm lifts, and which I was surprised, they're young girls
Hmm.
too. And I'm like, have you thought about this scar? Thinking I'm like, know what they are going through. And they're like, yeah, I want my arms to be thinner. And their scars, first of all, look amazing. So I think that's a testament to doing it younger sometimes too. But they are like, I want to wear these tight tops and these tight shirts, and it is well worth it to them. I'm so impressed by how happy brachioplasty or arm lift patients are. Um, and those patients aren't moms, which helps me go back to I get a lot of, like my sister who did this at 22 years old. She was like, I want to do my boobs, but I know I want to breastfeed. I know I want kids. What do you tell a younger person who is planning a family who has lost a lot of weight?
It's a timing issue. So if you are like you're trying to decide if now is the right time to start your family, now is not the right time to have your body procedure done. But let's say you're 22, you're not married, you
Mhm.
don't have any, you want kids, but it's distantly, I want kids
Mhm.
in my mind, I want kids. I don't think you should be forced to live with that loose skin for a decade until you find the right partner and decide this is the right time in your life to have a kid. That's kind of terrible. So
Mhm.
I think you have, and there'll be a lot of people that fall in between there somewhere. Again, it will depend on how much it bothers you, etc. I get asked a lot. Well, for example, should I just put my breast lift off? Like, forget weight loss patients, just in general. Like, should I have my lift now? Because I know I'll need
Mhm.
one in the future.
Mhm.
Depends on what you're willing to live with. It depends on the trade. What can I cover up? What bothers me? What's causing me to have a rash? And then if I do have my tummy tuck at 22, and then I have
Mhm.
babies, well, will I need another one?
Mhm.
Can't answer that. Maybe, maybe not.
Mhm.
Um, if let's say that you have a pregnancy at 32, had a tummy tuck at 22, you gained the recommended 25 pounds. If that happens to you, don't tell me. It's not what happened to me. But like I gained 25 pounds. I had a beautiful birth. That was wonderful, etc. Maybe you don't need, right? I told you it was probably
Mhm.
20 to 30 pounds where you would need to have something else done. So maybe you don't
Hmm.
need another tummy tuck. It's just
Hmm.
very individualized.
Hmm. No, that is hard. So that's why, I mean, I think half of these questions that you've helped answer for us, the answer is go have a consultation,
I know, and
go
I don't mean
talk,
to
go.
be like that, but like I can't give you the holy grail because it's not the same for every person. I can talk in generalities.
Yeah.
Um, in general, if you have a whole bunch of kids, your skin is going to be more stretched out than if you didn't have a whole
Hmm.
bunch of kids.
Yeah.
Does everybody need a tummy tuck that's had 3 kids? No. Well, first of all, does anybody need a tummy tuck? That's the other problem, right? Is that we
Yeah.
say need, but it's like, well, will it be worth the trade for you to have a scar? I think is really the question.
Exactly. Those are the fun ones as a patient care coordinator, who usually, especially with Amelia practices, you see after your surgeon and you kind of talk through more of the logistics, lifestyle pieces. That's the fun piece. Because I'm like, no one needs this. But where, does it keep you up at night? All the way down to, is this something you just thought of today? I'm a value girl. So I'm like, it costs this much. Here's the downtime. How much does it bother you? And it's fun sometimes to be like, girl, this is not, I don't think this bothers you enough to trade off the cost and the recovery.
Something
Most
that
patients who come in know, though.
Sorry to interrupt you, Greta. I got an idea and I have a little untreated ADHD. So I was like, I got to get it out before it leaves. You know what a lot of people ask me about, and I think they're embarrassed to ask me about. So I just want to get out in front of it. I don't know why, but if you used to weigh a whole bunch and now you don't, and all the fat went away, it doesn't go away in the mons. The fat pad over the pubic bone,
Oh, good
it
one.
doesn't
Yep.
go away. I don't know why it doesn't go away. Yes, I'm gonna make it go away. It's gonna go away in your tummy tuck. It's included. It's not an extra charge. I'm aware that it's there. I promise you it's there for every other woman who's lost a bunch of weight. And yes, it's fixable. So I just wanted to get
Yeah.
that out there.
No, I'm so glad. I don't think any other person outside of our industry uses the word mons either. I wish there was a PC, the your puffy uh V pubic area. I don't know. And people are, you're right, they're so embarrassed.
Well, I don't think they realize that everybody else has it too. I think it's like,
Yeah,
because you don't really see it unless you see somebody naked because it's covered
yeah,
in your underwear.
yep,
But I'm telling you, it is there 100% of the time, and 100% of the time, we will fix it.
yep, yep. That was honestly, well, it was one of my favorite parts afterwards, but it was one of the most shocking recovery parts because I
Felt.
did not expect the black and blue bruising and swelling to be right there. So I like to try to warn everyone I can about the first few days after
I
when
think
you
I've
see it in the
referred to
garment.
this the purple hot dog effect
Yeah,
of the
yeah,
labia.
yeah,
Sorry, temporary.
yep.
Don't worry about it. Normal.
No, no, I thought it was truly going to disfigure that area. It was so swollen. And you know what? It
It didn't.
got all,
Back.
sucked it all back up and it's back. And if it doesn't, I will see you for a labiaplasty anyway, which, was something else we can talk about. Maybe in a mommy makeover talk sometime,
Sure thing.
too. But no, I think you did the best job you could answering without seeing people because there are so many different, even you and I were of similar ages. I had 2 kids, you have 3 kids, and we had completely different surgeries depending, and we probably had similar weight gains and weight losses and things like that. And so it is really difficult. I would highly, highly, if you have like more than 3 questions, I would say go see a surgeon for a consultation. It is super valuable. And you can either then put it to bed and be like, oh, that is way more everything than I thought, or, ooh, I'm making a plan for this. So you guys are like all of our Amelia surgeons, and we have multiple locations. Again, Dr. Routen's located in our Raleigh, North Carolina location, which is lucky enough that I get to be next door to that one. But we do have locations all around. And, the Bustmob community is such a great supporter of us. It's so fun to do these things to support Bustmob. And if there's other questions that people have, you can always message Dr. Routen on Facebook, on Bustmob, on Instagram, all the places. How do you prefer people to ask you questions?
It doesn't matter. I like live. I got my little like phone wallet. I like live with the thing against me. So text, email, Facebook, Messenger, Instagram. I mean, I will say I have not been as diligent, and I should apologize to Bus Mob. I have not been as diligent to be trolling Ask a Surgeon. So if you're wanting
Mhm.
my opinion, you almost probably should tag me in it because I just haven't. I haven't. I'm sorry. There's a lot of things
Don't
on my to-do list, and that is getting knocked down because we have so many other surgeons that are doing it, and they're doing a fantastic job. So I'm not gonna. There's no reason for me to be like, I agree with Dr. Lopez.
Yeah.
I agree with Dr. Khan. So
Please stop apologizing. Mom of three, super, super busy surgeon, booked out, God knows how far. So we're just grateful you took this time to help
oh,
out the community. And pricing wise, this again gets confusing because I don't know exactly what you need. How does someone know? So we've done our best at Amelia to put our pricing online because I just think it's nuts that most places don't. I'm in the car shopping mode right now, and I'm not going to go look at a car that I don't know how much it costs. That would just be mean.
I hear
Yeah.
you.
Oh, I like that. You know, Lexus. I can't. Yeah. Well, I can't afford
And
that.
so it's
So we.
120K. Like,
Yeah,
yeah.
cars. I swear to God, you can't even tell anymore. I'll see one and be like, "Oh, that's not going to be that expensive." It'll be like 100 grand. I'm like, it's so surgery is the same. We want people to know at Amelia. We also do our best to include all the pricing.
Mhm.
I'm sorry, include everything in the price. So it's not like, oh, here's your price, but then you got to buy the tires and the undercoating and the this and sorry for car analogies again. But yeah, you can always go to askamelia.com. Thank you, girls, for dropping the link to that people can check out. And so it does go arm lift, thigh lift, all these things. We do offer combination discounts for having them done at the same time. Obviously, that is better for everybody a lot of times if you can save on recovery and OR time and things like that for us. So it's nice to be able to do that for people. Um, Anything else you want to add? Burning question stories about surgery and post weight loss. Do you like doing these surgeries? Are they complicated?
Well,
Are they
there you
stressful?
I think what's neat. So I love operating. So I'll operate on anything. If you have a mole, I'll probably take it off. Like I'll do whatever. Um, but they're interesting because they're more tailored to the person. Whereas breast augmentation, like yes, we're going to choose size, and we're going to choose profile, and we're going to choose under or over the muscle. But I mean, it's a breast implant. It goes in under or over the muscle. That's not as many choices as if we're trying to decide what bothers you the most, how are we going to get there, how many procedures are we going to do. Like I think that's it's more like interesting intellectually. So I like doing all of it. Again, like I'm not fussy, I'll do whatever you want. Surgery's elective, but I do like it. And they to the pay not everybody's a little different, right? But you guys have been through so much that like this is the fun part is getting to see you like, oh, suddenly you're wearing a smaller shirt that would have fit by the way before, but you weren't wearing it because you didn't want to see that. So I get to see you, and generally it's more than one stage, and so I get to know you a little bit better, which is fun. Um,
Mhm.
and I like being a part of that.
Yeah. Oh, they are fun. Again, I did a bad job about looking. You just got one more quick question,
Okay,
and this
sure.
is a good one. Well, there's two actually.
Okay.
So when do you release a patient to just simply walk post mommy makeover?
In the path.
Um, Yeah, like, and I now reading it twice, I realized she's like, "Do I walk out of my surgery?" But honestly, you kind of
You
do.
do. You do. I mean, yes, we're going to put you on a stretch. You're kind of still sleepy. You're too sleepy to walk out of the operating room, of course.
Mm,
So you're going to wake up on a stretcher, but then we're
mhm,
going to have you stand up and get in a wheelchair, and then we're going to push you to the car, and then you're going to walk to the car and get in the car. And if you do need to go pee in the recovery room, we're going to push you to the bathroom, and you're going to walk in the bathroom, and you're going to go pee. Walking is how we prevent blood clots in the legs and the lungs. And so we encourage that. We're not going to have a bladder catheter. Like you are going to get up and go walk to the bathroom. And then
mhm,
specifically, I want you to walk or take a few steps every 2 hours while you're awake in the first
mhm,
2 weeks to try to decrease the likelihood of you getting a blood clot. So walking
mhm,
immediately.
mhm. No, that was surprisingly better than I thought after my surgery. Would you recommend Miralax or a stool softener
Oh,
before surgery and during recovery?
oh my God, yes. And my kids are a little bit more grown. I used to say, I'll talk about poop all the time because I have toddlers, but I don't know if they'd really like to hear that
Yeah.
now. Yes, the bottom, unless you're somebody who's prone to having loose stool, you should start Miralax. And we tell you all this. You don't have to write it down right now, but
Mhm,
ideally you start Miralax 3 or 4 days before the surgery, like a cup full, like you want the poop to be soft. And then if
mhm,
you haven't pooped by day 3 or 4, I want you to take a stimulant laxative like Senna. so that you can get things moving. Because at least in my experience, the worst part, it's this uncomfortable tightness that you have from probably just the muscle repair and being swollen. And then you add on that constipation, like you're just like, nothing else can go in my skin. And so I do think that staying on top of the bowel regimen is really important.
I think the anxiety of being constipated for me was worse than the actual constipation. Like I literally on day like 3, I started like hour by hour monitoring, and yeah, way TMI, but it was that like I think I spent too much time on Bustmob beforehand, and yeah, I think day 5, day 6 I went, but that was stressful.
Like the first poop after vaginal delivery, you're like,
Uh,
okay,
Casey
what's
and I were
scary?
just talking about when they squirt you with the water bottle to try to get you to
Oh
pee
yeah.
after surgery too.
Oh
Like, what
yeah.
is that?
That's called a
Like,
peri bottle. That's because you might have a tear and you don't
I,
want the urine to sting it.
well, I had a C-section and they still
Oh
were like
yeah, they
attacking
were
me
still
with the,
squirting you with the bottle.
yes, yes. I was like, I don't know. Women can deal with a lot. We're amazing. You're amazing. Thank you. Thank you for doing this from home with kiddos running around and all your time. The Bus Mob community appreciates you always.
Oh yeah, not a problem at all. It was nice to talk to you guys again. I haven't done it in a long time. And so anyway, thanks, Greta. It's always good to talk to you. Have a
Of
wonderful
course.
day.
You too. Thank you,
Bye.
Dr. Outen. Bye.